Hello and welcome to Local Doctors on Call. I'm Alex Redmond. Millions of Americans visit physicians every year due to knee problems. The knee is the largest joint in the body and one of the most easily injured. Athletes are particularly prone to knee injuries, but if you are around for a certain number of years, chances are that you will experience knee pain. Here to answer all your questions about arthroscopic knee surgery is Dr. John Moor, an orthopedic surgeon specializing in knee and shoulder surgery. He has completed more than 15,000 surgeries in Sarasota over the past 18 years, and he's also on the teaching faculty of Florida State University College of Medicine. Welcome back to Local Doctors on Call, Dr. Moore.
Thank you. Nice to be here.
Yeah, it's good to have you back. We were talking about arthroscopy last week and also arthroplasty, but today we're going to be discussing arthroscopic knee surgery. So I think for people that might have missed last week's show, we should talk about what exactly arthroscopy is.
So arthroscopy means that we evaluate and treat the knee through very small incisions with an instrument that looks like this. This actually is an arthroscope, making noise here, sorry about that. This is what an arthroscope is. Through a lens here and a camera here, you place the scope through a very small incision, maybe this big, 2 incisions only, often small enough where you don't even need to put stitches in. And by placing that scope inside the knee, we can look at everything inside of the knee, including the kneecap, the thigh bone, the shin bone, meniscus, ligaments, cartilage, and then remedy whatever we find at that time. It's often a quick procedure taking 15 or 30 minutes. Oftentimes isn't even painful. You don't need pain pills, and it's often outpatient instead of being in the hospital.
So are you under a local anesthesia when you do this, or are you under a general anesthesia?
Almost all of my arthroscopies are under local anesthesia, meaning that we numb up the knee so you don't feel anything. Mm-hmm. And then if you wish to be wide awake and talk to me throughout the procedure, then that's absolutely fine. That's not an issue. In fact, some people wish to watch the monitor, watch their entire procedure with me, and even ask questions, and that's absolutely fine. Other people wish to be completely asleep, somewhat like colonoscopy. Maybe many people have had colonoscopy, and with an IV solution in your arm, you drift off and you wake up and you don't even know that the procedure's been done. So either it's completely under local or it's local with that sedation along the way. A few larger arthroscopic procedures require regional anesthesia, the entire limb. We rarely, if ever, do a general anesthesia on a knee arthroscopy.
All right. We'd like to let our viewers out there know that our phone number is 361-4675, and Dr. Moore is joining us live tonight to answer your questions on arthroscopic knee surgery. Again, that number is 361-4675, so go ahead and give us a call and he'll answer your questions. So is this sometimes called being scoped? Is that like a short term for that?
Sure. So commonly people refer to their knee or their shoulder or whatever joint as being scoped, and it's synonymous with arthroscopy. Just a microscopic look inside the joint through minimal incisions to get over the procedure much more quickly. Most of the time it's so small that there's no pain involved. You're up and moving the same day.
Now, what type of knee problems or knee injuries can be helped by arthroscopic surgery?
Anymore, most of all the knee procedures are going to be completed by arthroscopy, except for those things that require big incisions, for example, to put in an implant. So if you're putting in a total joint component with a component this big, you can't put that through an incision that's a centimeter big. Other than that, if we have a meniscus tear, it can be removed partially, or it can be repaired. We can reconstruct ligaments. We can regenerate cartilage in some instances. We can replace cartilage in some instances with allograft, or like a cartilage transplant from another person. Loose fragments can be removed. Malalignments can be corrected, like some people dislocate their kneecap, for example. And those can be realigned and replaced with the scope. Virtually anything that could be done open can be done arthroscopically, unless the implant is bigger than the incision itself.
Because that's cartilage is something that you just touched on. Can we elaborate a little bit more on that? With is that like shards of bone that come away from your
So
knee?
that's a common misconception, because people talk about having their cartilage removed. I had surgery 10 years ago and they removed my cartilage, and that's really probably not accurate, because cartilage is the rubbery stuff on the end of the bone. It's sort of like gristle on a chicken leg, the white stuff that caps the bone. Cartilage has no nerve supply, so it doesn't hurt when you're walking on it. Bone has great nerve supply. That's why fractures hurt so much. So when cartilage is gone, then it would hurt dramatically because it would be bone on bone. Whereas in this instance, in arthroscopy, you wouldn't remove cartilage voluntarily because it doesn't grow back, and you'd end up with bone on bone, which would be a bad thing. It would make you worse rather than better. What those people are talking about is having a meniscus removed. So if a meniscus, which is a cushion, if that's torn, then you take off the torn portion. Really quickly, what's a meniscus? If you can imagine a billiard ball sitting on a table, only one pinpoint of that ball touches the table. If you have a round donut and you place it on the table and put the billiards ball on top of the donut, then all of the force is borne by that donut and no force is on the table. And so the whole idea of the meniscus is to take that body force and dissipate it over a broad area so there's less pressure per unit area, and it protects the cartilage over time. So we're trying to prevent arthritic change by protecting the meniscus. But it's the meniscus that we treat with arthroscopically more than the cartilage per se.
All right, again, our phone number is 361-4675. That number is 361-4675 to have your questions answered by Dr. Moore. Now, if a person has arthritis and it's affecting their knees, is this a procedure or is there a way that you can use the arthroscope to help with that?
So arthritis is another entity that's sometimes poorly understood. People ask me all the time, so is it like rust that you have to go in and scrape out of the knee? And actually it's not at all like that. Arthritis simply means that the cartilage wears off the bone is exposed, the bone has great nerve supply, so it hurts. So arthritis can be dealt with in a number of manners with an arthroscope, but we can't put cartilage back on the bone with a scope, and thereby we can't cure a bone-on-bone arthritic knee with a scope. However, we can take away loose fragments, we can realign kneecaps which are arthritic and the cartilage is worn away completely. If one has locking of a meniscus fragment in an arthritic knee, we can get rid of the mechanical locking symptoms, but we can't necessarily turn an arthritic 70-year-old knee into an 18-year-old good knee.
So you can't help me, huh? No.
Oh.
All right, we have a phone call. We have Carrie on the line. Hi, Carrie. Welcome. Hello,
Hi.
Carrie. Welcome to Local Doctors on Call. Are you there?
Yeah.
Great. What is your question for Dr. Moore?
Hi, doctor. You did my shoulder for me when I pulled all the muscles out. And excellent job. I'm just about normal now. But I was wondering, why can't they use in arthritic knees the tissue that you have in your body to protect that knee?
Hi, Carrie. Thanks for calling. That's actually a great question because we actually can do that. So we have the ability to go and harvest cartilage cells from your knee and then send them to a lab and grow cartilage cells and put them back in. However, there's limitations because at present we need to have a reservoir in which to put those cartilage cells. In an arthritic knee, the cartilage is pretty much gone all across the knee, and there's no way to keep the cells where they need to be. So if we have a traumatic event where there's like a golf divot in a golf course where you can sprinkle sand in and the sand stays put, if we have that instance, then we can put those cartilage cells that we've harvested and cultured back in, hold it in place with a membrane, and we can make those things grow back. But we can't regrow meniscus, although we can do meniscus transplantations, kind of like a kidney transplant. We can actually do a meniscus transplant at this point. We can also do cartilage and bone transplants from another person to you. I hope that answers your question.
I have one more real quick question.
Okay.
After you have done my shoulder, which I pulled every muscle out of there and you repaired it, I now Canuck. And I just call it like, I don't know. Do you know what Canuck means?
Canadian.
No, it just means that it pops.
Oh, okay. That sort of Canuck.
Yeah, I
Okay.
Canuck a lot. And sometimes it hurts and sometimes it doesn't. What is the cause of the Canucking?
Okay, so when a shoulder has mechanical signs like popping or clicking or Canucking or whatever you'd like to call it, it has to do with some portion of the shoulder which is not smooth. So that could either be a bony prominence called an osteophyte. It could be bursal thickening. It could be the tendon. It could be loose fragments. It could be lots of different things. But if you have more questions about your shoulder, I'd be happy to talk to you. Give me a call at the office. I'll be happy to talk to you. You can come on in at any time. But unfortunately, we have a lot of knee people waiting right now that need to answer their calls.
We have another caller on the line. Thank you for your call. We have Chris on the phone. Hi, Chris. Welcome to Local Doctors on Call. What is your question for Dr. Moore?
Yeah, I had orthoscopic surgery on my knee, and now it, like she said, conducts, but it pops, and it hurts really bad. And I was wondering if my surgery was completed all the way, like if they got all the cartilage out of the way that they needed to, or what's going on.
There are, hi Chris, there are many types of problems that can cause clicking and popping in a knee. Maybe the most common is that your kneecap is no longer smooth, so when you simply straighten and bend your knee, even in a sitting position, that'll make it grind and pop a fair amount. Otherwise, there could be scar tissue, there could be a displaced meniscus fragment, there could be loose fragments like marbles floating around inside your knee, or either there's cartilage damage on the end of your thigh bone and your shin bone. So lots of different reasons could cause popping in your knee, and probably need more of a workup before I could be very specific about that. Oftentimes a simple x-ray will do that, exam can do that, history can do that, if I could have a little bit more of your time, and then MRIs can help us as well.
Thank you for your call. And Dr. Moore, why don't you give out your phone number really quickly so that people can contact you?
If you need to contact me, it's 957-1500, of course area code 941 here in Sarasota.
All right, we're going to go ahead and take a little break, and when we come back, Dr. Moore will be answering more of your questions about arthroscopic knee surgery and how far we've come with knee surgery. So stay with us. We'll be right back. Welcome back to Local Doctors on Call. I'm Alex Redmond, and our guest today is Dr. John Moore. He is an orthopedic surgeon specializing in arthroscopic knee surgery from Advanced Sports Medicine Center. And we do have a phone call. We have Joe on the line. Hi, Joe. Welcome to Local Doctors on Call. What is your question?
Yes, I know that the doctors explained that he's done knees. I had an insert implanted in my big toe on the right side, and this is years ago, and it fragmented. It was a phenolic type of plastic thing they did. It was an old man's, I guess, operation. I had it done when I was 28. So I wonder, do you do that with arthroscopy? Can you do something like that to fuse that or to get in there and clean it out because it's fragmented? Can you do that with arthroscopic surgery? No?
Hi, Joe. Yes, indeed. All sorts of joints, including small joints like a toe, can be arthroscoped. So removing that fragmented silastic insert, which is sort of a rubbery implant that was done years ago, not so much done anymore, that can be removed without difficulty arthroscopically. However, fusing the joint would probably be better done with a small open procedure. It doesn't take much more effort, and it's much more successfully done. So it probably require a small open procedure to take care of that one.
All right, Joe, thank you for your phone call. Doctor, how have we progressed with knee surgeries and arthroscopy in comparison to how it was in the past?
Over time, we've gone from big procedures where we made big incisions on knees to take out menisci, take out fragments and that sort of thing. And now it's a matter of doing arthroscopies under small incisions and regional anesthesia. So the day when you had a lot of pain with surgery, you had to stay in the hospital, you had to be in the hospital at all actually, the day that it required general anesthesia, tourniquets, all those things are gone. So a typical arthroscopic meniscus surgery takes between 15 and 30 minutes, does not require general anesthesia, there's no tube in your lungs, no ventilator, no respirator. It's just a matter of numbing the knee so you don't feel anything, then you can be wide awake and be aware of what's going on, or you can have sedation along the way as well. So the procedures are much improved in that they're not painful, they're reliable, it's quick, it's easy, it's not risky. The risk of infection is almost zero because it's constantly irrigated and wash away any germs that happen to be in on the skin or anywhere else. So it's a relatively risk-free surgery. It's quick and fairly simple, always done outpatient at a surgery center anymore.
All right, we have Jim on the line. Hi, Jim. Welcome to Local Doctors on Call. What is your question about arthroscopic knee surgery for Dr. Moore?
Actually, it was about an ankle surgery. I'm fairly confused about it. I had an ankle surgery about 30 years ago, and now I have bone on bone. The cartilage is gone, and they're telling me that ankle replacement is not the way to go, and possibly a fusion. I was just trying to get a second opinion.
So ankle fractures and the like tend to have degenerative changes over time. So if you had a bad ankle fracture 20 or 30 years ago, it wouldn't be uncommon that the cartilage will wear over time and you'll get advanced arthritis, so it will be painful, you'll lose motion. And certainly an ankle fusion, where you take that stiff, painful joint and make it painless, is available arthroscopically. So that's a procedure that's well done arthroscopically, and effectively you take the shin bone and you make it grow to the foot bone so that there's no pain any longer. In an arthritic joint of your magnitude, you probably have very little motion anyhow, so a fusion would hardly lose any more motion than you already have, but it would not be painful anymore. As far as total ankle replacement, that can be done. It's not as durable as is a fusion. So there are indications for both, but if yours has been a long time, it's very stiff and deformed perhaps, and a fusion is a good way to go, and that indeed can be done and well arthroscopically.
All right, thank you for your call. And again, our phone lines are open if you'd like to call and ask Dr. John Moore a question about arthroscopic knee surgery. You may call us at 361-4675. And we're going to go ahead and take a break. So we'll wait for those phone calls and stay with us. We'll be right back. Welcome back to Local Doctors on Call. I'm Alex Redmond, and today we are being joined by Dr. John Moore. He's an orthopedic surgeon specializing in arthroscopic knee surgery. He's been explaining all of that. And Dr. Moore, I believe that you actually had your knee scoped.
I did, and so even though it was some years ago, we were doing it the same way under local anesthesia. I was wide awake during the entire procedure. In fact, the surgeon who did it for me trained with me, so I knew he knew how to wield an arthroscope well, but he'd never done it under local anesthesia before. So I was his index case under local anesthesia, and of course it went very well. He did a great job, and my knee was better instantaneously, and I actually was able to drive home, although maybe that's not the average. So it worked very well, and that's a good way to go, just to prove that I did it on myself, or had it done on myself.
But you wouldn't advocate your patients driving themselves home, surely.
In my instance, they didn't have any. I didn't have any sedation. I had no narcotics. I had no anesthesia.
Wow.
I had nothing. I just had he numbed my knee for me, so I didn't feel anything. And I coached a little bit along the way to his unhappiness. But
No. A bit to the right, a bit to the left.
Exactly, a little more
That's
off the top. And so it really wasn't much of an issue to drive because it was my other knee and I was able to take care of it.
All right, we have Sal on the phone. Hi, Sal. Welcome to Local Doctors on Call. What's your question for Dr. Moore?
The question was, I do a lot of running, and it doesn't hurt my knee at all because I guess it's a straight motion. But as soon as I get on the wrestling mat, because I'm a wrestler, and I start with the lateral movements and things like that, it pops and it hurts really bad. And I don't know why it doesn't hurt when I run straight, but when it gets lateral, it starts to.
Oftentimes that has to do with cartilage versus soft tissue. So if you're running in a straight line, it's acting like a hinge joint, and as long as you have normal young wrestler cartilage, you're not going to have any problems with running straight ahead. But if you have a meniscus, a collateral ligament injury, a popliteus tendon, a joint lining, anything like that that's injury or been injured or is irritated, then by twisting it, it'll cause lots of pain. So you probably have more of a soft tissue injury than you do a cartilage arthritic sort of a problem. And that can be remedied. Probably needs to have a little bit more diagnostics to tell you specifically which structure has been injured.
All right, thank you for your call. And we have Steve on the line.
Should I do a lot of physical therapy?
Hello, Steve. Welcome to Local Doctors on Call. You have a question for Dr. Moore?
Yes. Dr. Moore, what is more prevalent, the knee arthroscopy surgery or shoulder arthroscopy surgery?
Which is more?
What is
Prevalent.
what is
What-
more?
what-
do you want to know
what-
what is more common for people to have
Yeah.
done? Or what's
Oh,
As far as your experience, you do more knees than shoulders, or
I do a little bit more knees than shoulders. I think knees are a lot more prevalent than shoulders. They're in the public, people injure their knees a lot more than shoulders, so that's what happens to be in my office. But I have colleagues across the country who do nothing but shoulders or nothing but knees. So in my practice, it's slightly slanted more toward knees and shoulders, but maybe 10 or 20% more knees and shoulders. Why do you ask?
well, I'm going to come visit you about
Okay.
the shoulder surgery.
Yeah, it's roughly half and half, and that's because I did a sports medicine and an arthroscopy fellowship. And in sports medicine, it's mostly knees and shoulders because that's what athletes injure.
Thank you so much.
You're welcome.
All right, thank you for your call. And we'd like to give out Dr. Moore's number one more time. It is,
957-1500 here in Sarasota, area code 941.
again, that's 957-1500. And of course, people can go and visit your website, which is advancedsportsmedicine.com.
That's it.
That's it. I remembered it. No, it's a great website, and there's a lot of questions that can be answered there as well. And our phone number, if you'd like to call us today, is 361-4675. And we have John on the line. Hi, John. Welcome to Local Doctors on Call.
Thanks. My question is, I had a medial meniscus tear. It was beyond repair, so I had it removed. Would I be a good candidate for a replacement? And if not, about how long until the knee replacement? I'm very active and do heavy squats at least once a week.
I love that question because that's right in my wheelhouse. So the indications for meniscus repair are bigger and bigger all the time. So whereas maybe in the past it wouldn't have been repairable, maybe it is repairable now. A meniscus repair effectively is only utilized when the meniscus structure and function is gone, but the cartilage is still good. Once the cartilage is significantly worn, then the meniscus doesn't have any reason to be. The meniscus is there to protect the cartilage. So if it's down to bone on bone, there's not much reason to have a meniscus transplantation. However, if your cartilage is in good shape and you have no meniscus function and you plan on doing vigorous things, it is a reasonable thing. It does not make your knee 18 years old again. What it does is give some function for 7 to 10, 12 years, and that's what we found in our studies over time. So it doesn't make your knee normal still. Doing deep squats is tough on knees, so we may want to let some water go under that bridge and alter your workouts a little bit. We do want you to be active, but there are activities which are good for your knee and some which are bad for your knee, and so it might be worthwhile to have somebody take a look and recommend, relative to the problems in your knee, what should be done and what should not be done, how to protect it, and maybe last for the rest of your life without having any further treatments done to your knee.
All right, thank you for your call. What is the extent of problems that can be helped by arthroscopic surgery? And can arthroscopic surgery help you to avoid having a larger surgery with, say, bigger incisions?
Yes, the arthroscopy is expanding all the time, and so just last weekend we taught a course where we went through cartilage transplantation from other people. So if you have a focal defect in the cartilage, it can be transplanted from another person. We can transfer cartilage from your own knee from a lesser used area to a more used area. The cartilage can be taken and harvested and put back like we talked about before with a membrane. We can do osteotomies and change alignment and that sort of thing. So lots of ongoing and growing indications for knee arthroscopy.
All right, thank you for your call. And we have one more phone call. We have Joanne on the line. Go ahead, Joanne.
Hi, I would like doctor's intake about what he thinks about injecting the hyaluronic acid into your knee.
Hyaluronic acid is a form of treatment for cartilage wear. And so hyaluronic acid is part of the lubricating fluid called synovial fluid in a normal knee. And so the injections that include hyaluronic acid are effectively the same thing with a higher molecular weight. So it's like adding a better grade of oil to your engines or to your car's engine. And so there are 5 different types, and their purpose is to diminish symptoms in a knee that has cartilage wear, early arthritis. And so it doesn't regrow cartilage, it doesn't cure arthritis, it solely is for symptoms. About half the people say they have great effect and great relief. Half the people don't find so much relief, virtually no one gets worse. So it's a matter of an injection each week for 3 weeks, have a 50% chance of markedly diminishing your symptoms alone.
All right, thank you for your question, and we'd like to thank you for tuning in to Local Doctors on Call. We'll see you next week, and remember, it's your health.